People who need knee replacements are people with end-stage changes to their knee joint. Now that can be also in younger patients after trauma. It can also be in patients with systemic disease like rheumatoid arthritis. But basically it's a worn-out knee. Prior to surgery, we encourage our patients to be in the best medical shape they can be, whether it be through weight loss or controlling any chronic medical problems. We also want them to see their family doctor to make sure that the patient is well prepared for surgery and is physically in their top form to undergo the surgery. Well, the surgery takes a little over an hour to do. That's about an hour and a half of total anesthetic time. During the surgery, the patient can either go to sleep completely with a general anesthetic, or they can have a spinal anesthetic and be numb from the waist down. The goal is to do two things in knee replacement surgery. Our goal is, number one, to restore normal alignment to the limb. Many of the limbs that we take care of have either become bow-legged or knock-kneed over time, so we want to restore normal alignment to the knee. And the second is to remove diseased tissue, arthritic tissue, cartilage, and bone that has degenerated over time. So this is a pretty generic model of a knee replacement, and what we do is we replace the end of the femur bone, and perhaps you can see that these are very chamfered cuts. We don't just cut off the end of the bone. So this is a component made of metal. There's a hard plastic component called ultra-high molecular weight polyethylene, and that is the actual bearing surface, and that is set on top of the tibia, a tibial component, which is a flat tray that sits on top of the tibia. We also will resurface generally the underside of the kneecap with a small plastic button of that polyethylene. One of the things we do now is we put medicine inside the knee. It's actually a cocktail, we call, of 4 different medicines to help with pain control, with bleeding, with inflammation. So that starts actually in the operating room. That plus a nerve block will numb the leg for them. So our biggest goal is to, control, after surgery, control that pain that might limit a patient from moving their knee. We want our patients to be comfortable, but we also want them to be alert and not heavily reliant on narcotics. We will give them various medications to help control pain, and we're going to want our patients up and out of bed that evening of surgery. We want them up walking with assistance to begin the rehabilitation process. The length of therapy depends on their progress. It's normally going to be about 2 months of physical therapy, structured physical therapy first, where they receive therapy in their home for the first couple of weeks, and then after that we have them coming to an outpatient therapy setting where they can have access to more equipment, more hands-on things, actually start to compete a little bit with their friends and neighbors who've had similar surgery. When it comes to return to athletics, let's say, there are some limitations. We ask our patients to not try to participate in marathons anymore, but certainly if the house is on fire, they should run. But running for exercise is probably something we don't encourage. But tennis, golf, cycling, swimming, all great things after you've had your knee replacement.